All right, great. I'm going to get started. Thank you again so much to all of you for being here, and please continue to introduce yourselves in the chat. My name is Caroline Ioso, and I am the Senior Policy Associate at Homes for the Homeless. Today, we will be talking about programs that engage families and support children's educational needs in shelter and in the communities in which they live. I wanted to share a couple of housekeeping notes for today's webinar. We have a Q&A function in this webinar, so please use that to share questions for the panelists. And we, as I mentioned before, we have a hashtag. We encourage you to engage with us on Facebook, on Twitter, or via email during and after the event. And finally, we will also be sharing a survey for your feedback and a recording of this webinar later this week. So to start us off, I want to welcome the Executive Director of the Institute for Children, Poverty, and Homelessness and Homes for the Homeless, John Greenwood, to say a few words.
Hi, everybody. Thank you for joining us today. It's exciting to see so many familiar names and organizations, and of course, a lot of new folks on here as well. As some of you know, for the past 10 years, ICPH has always held a conference every 2 years. So for the past 10 years, every 2 years, we held a conference. We brought together policymakers, academics, practitioners, providers, case managers, social workers, elected officials, government officials, et cetera, anybody who was sort of interested in family homelessness and all the things that come with that tended to come. It was a great experience. I think for a lot of us, we miss those in-person times. I surely do. It was a chance to network with each other, both locally for us in New York, to see some colleagues in New York, but then nationally to see people that are doing similar work in other places. Some of the best conversations I had were over a sandwich at lunch, walking to a panel, coming back from a panel and reflecting on it. So we can't do that, at least not yet, bring everybody together in such a large environment. However, we want to do something a little bit different and to keep that conversation going. We hope this webinar, this seminar, will sort of be that. So hopefully you can use the chat, you can ask questions. Maybe you follow up with a colleague after this to talk about what you learned if someone couldn't make it. But I think all of us, from what I hear from people, want to keep this conversation going. I think right now, especially with what we've all gone through, I think we want to talk about it. There's a lot to reflect on, and there's a lot of good work that's happened. It's been a trying time for the last 2 years for all of us throughout COVID. But I think, I'm especially proud of this community that's really stepped up to work with families who are experiencing homelessness every day, given all the obstacles that we've faced. I think our communities, all of us who work in this industry, we've all had to face a lot of different types of disasters, right? We've had to respond to hurricanes and floods, earthquakes, the September 11th attacks, and now a global pandemic. But I think each time what I always see is that people come out with new ideas, new thoughts, new ways to solve the issue, new approaches, sometimes returning to old approaches. So this is our first webinar, hopefully of many. Of course, we chose to do something that's child-focused because that's what we really think a lot about. So I'm happy this is our first one. You're going to hear from two groups who have done some innovative stuff for kids, both school age and early ed, both throughout the pandemic and pre-pandemic. So hopefully you find it fruitful. I hope that you also read our magazine that we put out in January called Beyond Housing, because there'll be more information to come on that, and that you'll look for our future publications. So on that, I hope you enjoy. I'll turn it over to the panelists and Caroline, and let us know what you think. Thank you.
Thank you so much, John. I am now excited to introduce our moderator and our panelists. Our moderator is Robin Schwartz, Policy Advisor at Homes for the Homeless. For the Beyond Housing magazine, she authored the article, Time to Build a Better Shelter to School Bridge, a retrospective on the experiences of New York City students and families in shelter during the pandemic school year. And we are joined by Rosalind Edwards, Director of Early Childhood Education Programs, and Joe Willard, the Vice President of Policy for People's Emergency Center in Philadelphia. Joe and Rosalind are co-authors of the article, Family Homelessness Providers and Head Start, Natural Partners, Taking the Model Statewide. I would also like to welcome Michael Chapman, Director of After School and Recreation, and Max Rain, Policy Assistant, both from Homes for the Homeless. Michael and Max are co-authors of the article, The Saratoga Youth Council, Giving Youth Experiencing Homelessness a Platform for Individual Development and Community Building. For panelists' full bios, please see the link in the chat. And now I will pass it over to Robin.
Thank you, Caroline, and welcome everybody again to what is sure to be a fruitful discussion about education and engagement with families in shelter. We're particularly excited that our panelists work with children across the age spectrum, from early learners to elementary, middle, and high schoolers. And we'll touch a bit on the 0 to 3 group while discussing high quality childcare and early Head Start. And we may talk about post-secondary visioning in the context of working with preteens and teens. But we think that developmental and educational supports for infants, toddlers, and young adults each merit their own discussion if we don't get to them today. I now have the pleasure of introducing the 2 programs that we're going to delve into. I'll start with the Philadelphia-based People's Emergency Center, or PEC. Their Building Early Links for Learning, or BELL program. In the mid-2010s, PEC, a nonprofit that provides affordable housing units, job training, parenting and early childhood education, financial education and planning, life skills and technology classes to families, children, and youth experiencing homelessness, turned its attention to the pressing need for high-quality childcare and early intervention services for children experiencing homelessness. The BELL model is a multi-pronged approach that combines elements of advocacy, research, program design and implementation, and network building to transform access to high-quality early education for homeless families with young children. Early childhood education, or ECE specialists or navigators at BELL, help parents in shelter access early learning programs anywhere in the city, with a focus on getting children connected to high-quality, subsidized early Head Start and Head Start programs. Having this hub of dedicated staff who can facilitate family access to needed services and having an intermediary like BELL to establish and maintain the structure, as well as advocate for the educational needs of young children at both the local and state levels, is very helpful. The second program that we're going to learn about today is the Saratoga Youth Council, which is based at the Saratoga Family Residence in Jamaica, Queens, in New York City, and it's operated by Homes for the Homeless, or HFH. HFH provides families experiencing homelessness with more than just a place to sleep. The agency runs 4 family residences, which are located in the Bronx and Queens. HFH offers childcare, early education programming, after-school recreation, wraparound social services, and employment training intended to ensure a holistic and community-oriented support system for families. HFH has adopted a family-based, child-centered, education-focused approach to its programming that aims to break the cycle of poverty, foster positive identities, and promote future success while allowing kids to grow, experience, and learn as kids do. The Saratoga can house up to 255 families at a time. Families receive placement at the Saratoga through the intake process governed by the New York City Department of Homeless Services. And the average length of stay for families in transitional shelter citywide right now is currently over a year. During their months-long stay at the Saratoga, children regularly find stability and community by participating in its after-school program. The Youth Council is a component of the Saratoga's after-school program and aims to give young adolescents a voice, empowering participants under 2 umbrellas: individual development and community building. Better understanding, developing, and utilizing the collective voice of youth is critical in both focus areas. There's also an emphasis in the Youth Council on skills-based learning, practicing consensus building, and peer mentoring. When you all registered for this webinar, you were invited to share what you hope to gain from this discussion. So we know that you're interested in learning how to improve services, how to better understand how experiencing homelessness affects school-age children, and how to best support them in shelter. You're curious about how to get families and children engaged in activities and how to implement innovative programs in the shelter setting. You also want to know how to help community partners understand the importance of working with families experiencing homelessness. And finally, and I think this one sums up all of these concerns, you want to know how to empower children and families who are experiencing homelessness and housing instability. So hopefully we will hit on all these points during the panel, but if these or other questions aren't answered, please send them in using the Q&A functionality so we can come back to them. Our panelists, I know, are ready to jump right in. So first we'll turn to Michael Chapman with the Saratoga Youth Council. Michael, can you tell us about the impetus to start your program? What need were you seeking to fulfill?
Sure. First of all, I want to thank everybody for joining us. It's a wonderful platform, and we just look forward to the overall experience. You know, my father was a pastor, old school pastor, and he used to love preaching. And there was one thing that he would always say: he would look in the front row, and if people were into it, he continued preaching. He know he's doing a good job. He did a Zoom sermon most recently, and he was thrown off because he couldn't see anyone, so he couldn't gauge how he was preaching. He couldn't get the feel. But so we spoke about how it's a new world, a new level of communication. So we just thank everybody for joining us today in this unique venue. The Saratoga Youth Council is interesting how it grew and developed almost from a grassroots level. We have really three mantles that we sort of focus on. One of those is to identify or help youth identify their talents, skills, and abilities and really grow and develop them. The second mantle is to help kids recognize and manage their emotions. And then the third one is overall leadership development and the ability to communicate, use your voice, and use your both individual and collective voice. So given those three mantles, we sort of look for just overall opportunities to grow and develop. So we do a number of roundtable discussions with the kids, and out of that, we said, what do you all want to make this a better program? And we took that to say, okay, well, now let's take it to the next level. Instead of saying what you want, let's form a group and really develop. So it just had, morphed into the opportunity for us to introduce, well, how do you communicate? Kids don't really, debate. They just yell and scream. So, okay, now let's introduce Robert Rules of Order. Let's introduce different methods to discuss. And sort of it just grew and provided an opportunity for growth and development. Out of that, interesting, because we did not plan, we have the youth council, which is really ages 10 to 14. And the kids who were 7 and 8 year olds saw what they were doing, and they, oh, why don't we have a council? So now they formed the kids council. So now we have a kids council and a youth council. And again, it gives the opportunity to grow, develop, to plan things. It's really about planning and learning to communicate. We do a town hall meeting every day. And it's interesting because I carry a book into the town hall meeting every day. I tell the kids, if I come in this meeting without this book, you all get a pizza party. But also the kids council and the youth council have their own book too, to take notes. And we're able to say, okay, what was the topic of discussion on last Wednesday? And they'll look through the book and say, oh, we talked about focus. So just the ability to introduce certain things of, whether it's a teaching point and how kids grow and develop and how that transferable skill now is introduced into the schoolwork. So now, whereas before the book bags might have been just paper stuff all in the book bag, now the book bag's a little more organized because they have a notebook, because they know that they have to be a little more focused with their notes. So it really morphed from really just helping kids identify the need to really communicate.
Thank you. And Rosalind Edwards of Peck, how does your program define family engagement? What have been some of your greatest program wins pertaining to family engagement, and what are some of the greatest challenges?
Hi, again, I join in with Michael to say thank you for having me today. Really excited to be here. So the Bell Project stands for Building Early Links for Learning. So the linkage that we seek to have are between two systems, the housing system and the early childhood system. It's a multi-pronged approach that combines elements of advocacy, research, program design and implementation. Network building is really important to transform that access to high quality early childhood education for children experiencing homelessness. We believe and we know that children will benefit if they are in high quality care, child care or early childhood programs. They can benefit from early intervention services such as speech, physical, or occupational therapy, and get a head start in life. So that's the foundation. As far as family engagement, we do 4 core experiences for family engagement. We conduct quarterly early childhood education workshops for our families at the shelter, pre-COVID, at the shelter, during COVID, mostly through Zoom. We have annual enrollment drives so that what we do is, and we call them parties because that sounds so much more fun than an enrollment drive. So we have enrollment parties at the shelter. We invite all of the local early childhood programs as well as the school district to attend, and they table, and families sign up right there at the shelter. They go through the line, talk to each of the providers in that area to see which early childhood program fits their needs, and the application process is done right there on the spot. So we really enjoy doing those. We do those annually, but we do them more often than annual. It's in our grant we say annual, but we do it as often as we can. We also have direct conversations with families sometimes when they need or find that they are having barriers to have access. And if they have questions, we are there for them and make ourselves available, give them our phone numbers, our cell numbers. And when we are there, we develop those relationships. And we do that in partnership with housing staff. And then lastly, we provide technical assistance to families, sometimes when they are running into challenges in getting enrolled in a program. They may not have all of their paperwork because they're experiencing homelessness. They may have had to leave a situation quickly and may not have the typical conventional things that some early childhood programs like to have during the enrollment process, and we can help step in and help parents with that. And you asked, yeah, you had other questions. So our wins, oh wow, we've had so many. So one of the wins, there's a story we like to tell that's also in the article, just to give you an example of what it's like for families and types of conversations that we have. We had a young mom who was in high school. She was experiencing homelessness at one of the shelters. And she, along with, she was in the shelter with other moms and their children. She had a 3-year-old son and she had a 7-month-old daughter. She had a 3-year-old son, 7-month-old daughter in a shelter, and she was looking for a job and she needed to find a place to live. So that was a difficult spot for her. At the time, the shelter staff needed resources to help build their capacity to what the landscape in Philadelphia was for early childhood programs that would meet her needs, because we have many and they all have different qualities. So one of our staff stepped in, worked with her case manager, and found a place for this mom And she was able to enroll her child into an early Head Start and start the track towards getting a job and finding a house. And that was something that really stood out for us, and we share that story often. Okay, challenges. Yes?
Sure.
Well, I think we spoke to some of the challenges that all of us had, which was COVID. We were in our groove, we were 2 years old, we're working and developing relationships, and things are starting to gel, and then we had to go virtual. So we had to be nimble. We first took time to just take care of ourselves, because we are people too. And I remember telling this story to one of the panelists that once we figured out, okay, wow, what's happening here? We had questions. We took about 2 weeks, or maybe 2 weeks to a month, for staff to just, talk to doctors. We had physicians come to our internal meetings to just tell us what COVID was, what was happening, and how we took care of ourselves. We had to do that first. We had to give ourselves oxygen first. Once we were able to regroup, then we were able to think outside of the box. And I hope to share some of those innovations later in the panel.
Thank you so much. And Rosalind, there was one clarifying question. Just someone would love for you to repeat, and it might have been answered already, your first core experience, but that might have been answered. But if you quickly want to jump on it.
The core experience with the mom who was living in shelter. Is that the one?
No, I think you said you have 4 core experiences.
Oh,
like when you were
engagement. Yes.
Yes.
I will repeat those. So the first one are workshops. We do quarterly early childhood education workshops throughout the city at different shelters. Now we're doing it virtually and hope to go back to that. Secondly, we have enrollment parties. We call them, they're enrollment drives, but they're enrollment parties at the shelters. Thirdly, we have direct conversations with families regarding high quality early childhood programs. And then we provide technical assistance as needed if a family is running into a challenge in getting their children enrolled.
Thank you so much. I think somebody has their own book that they're writing this down in right now. So Joe, Willard, also of PEC, what kinds of partnerships are needed to make a program like the Bell Project work?
Thank you. It's all partnership work. And I've been thinking about that question. I broke it out into 3 areas: community, outsiders, academics, and funders. So in the community, this is back in 2010 when we started, we really had to bring the shelter system together and talk about how can we best serve the needs of children and all. So we had this thing called Family Service Provider Network. 18 groups are involved in that. The executive directors were all involved in that, and that really helped us then go to the city and say, you guys don't require us to do anything for kids. We need to address that. So in partnership with the city of Philadelphia, we created the Children's Work Group, and that broke out into 5 different groups, and about 40, 50 people came to meetings every single month. And we looked at the major areas of services that children need. That group continues to this day. We now call it the Children's Work Group Early Childhood Conference because it has a professional development aspect to it. But we plan and we implement folks coming together from different sectors, right? The public health system comes, hospitals come, early intervention folks, county government, academia, home visiting folks all come every single month. And we talk about what needs to be addressed at that time. So that internally in Philadelphia, that was the main groups, but you have to have outside collaborations and all. The Pennsylvania Head Start State Collaboration Office has been one of our greatest partners in there. Tracy Duarte, who helped us write with the article, really helped us figure this out in a lot of ways. And we know that Head Start has, back in 2014, 2015, the National Office of Head Start said that homeless kids have a preference. And so we looked at each other and said, we have homeless kids, you have a need, let's come together and all. And around 2014, without the partnership of Marcia Baslow, who at that time was with the Administration for Children and Families, she was a policy person there. She brought Department of Education, HHS together and said, we have to have a policy statement of what shelters need to do for young kids 0 to 5. Once she put out that paper, we were able to take that to our housing people and said, look, federal government wants us to do something with kids, and here's a bunch of great ideas. And that really helped us, because at 2014, 2015, the discussion about housing first meant that no services. It was misinterpreted that way, but that was the conversation. This policy document really helped us turn it around and say, no, we do have to serve kids 0 to 5. Without Barbara Duffield, now with the Schoolhouse Connection, we wouldn't have the vision, the inspiration, the passion about serving kids. And we were able to tell the local folks, look, nationally, these people led by Barbara Duffield says, we have to do this type of work and all. So it just wasn't the housing folks saying, we have enough problems, just think about housing. Folks like who had a vision like Barbara Duffield really helped us say, no, we have to really continue in this. And last but not least, our other big national hero was Dr. Grace Whitney out of Connecticut. She was the former Connecticut Head Start State Collaboration Office Director. She tested this idea out roughly 2008, 2009. We heard about it around 2010, and since then we've been working together. And it was her inspiration and her experience of managing what Roz is doing with her team that really has led to this partnership many years later. So those national partnerships are extremely important. The academic partnerships are incredibly important. A lot of housing research says, family homelessness is declining, child and youth homelessness is declining. And we needed academics to help fight against that stuff. We also needed their expertise in what works and what doesn't work and all. So folks like Dr. Sarah Shaw, who's now with Child Trends, was one of our first investigators back in 2016 to help us understand the work. Dr. J.J. Catulli, now with Nemours University, formerly with Rutgers and the University of Pennsylvania. Dr. Jeanette Herbers out of Villanova. And there was Dr. Stacy Perlman, who first really created this idea many years ago. Dan Tregley out of the University of Pennsylvania and Cloudburst Consulting, just to name a few of the academics we were able to engage with and help us develop this intervention that we did. And then finally, the funders. Without the collaboration of the funders, they weren't necessarily concerned about housing and homelessness, but they were interested in children and families. And so we're able to articulate to them what could possibly happen. And we brought them all together, funders, academics, the outside leaders, and the internal leaders coming together. And that's really what created the Bell Project.
Wonderful. And Max Ryan from HFH, kind of segueing from this policy and academics question, how has research and collecting data helped tell the story of these programs? And how do you see practice informing policy and research?
Sure. So first of all, great to be here. For the first question, research and collecting data are really important for identifying and just communicating both one, the value of implementing certain programs or initiatives, and also just what's working well in those programs. And communicating these two things together can really help tell the story of a program. So for example, with the Saratoga Youth Council, we interviewed members of the council, and they just spoke to us about how great it was to have a say in what was going on in the Saratoga community. And these interviews just really helped us capture the essence of the program and why the members themselves and the clients really found that valuable. And then I guess for the second question, for how I see practice informing policy and research, practice is really what policy and research is all about. So policy or research that's not grounded in practice of programs is not going to be super helpful. There should always be an open conversation between the two. And yeah, the practice informing research and then research informing practice. And yeah, just our best research projects have come from the ideas of people working directly in shelter operations and shelter staff. So largely because they're bringing the concerns of those residents to the project, and also just helping connect residents to the research project either through like surveys or interviews. So one example for that would be the project we did on new parents at HFH, some of which is seen in the Data Digest section of the magazine, was that was largely based off of questions from the shelter operations staff about what new parents needed and sort of supports that could be provided. And shelter staff really helped us every step of the way with that project, from like shaping the research questions to what was the best way to collect the data to what was the best way to analyze that data. So yeah, just working really closely with both clients and shelter staff is sort of how I see practice informing policy and research.
And Rosalind and Joe, I don't know if you have anything else you'd like to add in terms of the practice and research interplay.
One practice that we have is, and we totally agree with the practice and the research interplay. We meet once a week, and during those meetings on the agenda, at the top of the agenda is data, a data analysis and data discussion. In fact, we have 2 meetings about data every Friday. And that helped us to be nimble. That helped us to be flexible, because based on that data, we were able to analyze, what was effective the prior week and what we can put on our plate for the next month. And I think that was probably one of the most efficient ways or most effective ways for us to wrap our head around what was going on with COVID too. We looked at the numbers. So I think that's really important. We also share that data, and Jill will get into that. We share that with our community, our stakeholders, and we start small, what's happening in Philadelphia, and then we collaborate with others to see what's happening statewide. Jill, you want to add to that?
Sure, just 2 things. One, the researcher holds our feet to the fire and makes us accountable. And sometimes numbers don't look good, but we got to be honest with ourselves. 2, I remember way back, I used to work for United Way, and back in the 2000s, foundations across the country were saying we want impact. We're not funding human services unless there's demonstrated impact. And a lot of times funders weren't funding the research component. Thank goodness Vanguard's Strong Start for Kids Foundation embraced the fact that we could bring on an independent researcher to help us look at our information and all. And without that type of vision, we nonprofits, we just don't have the capacity. So I'm glad the foundations are changing in that way, because we can demonstrate some impact.
Well, I would add, and I thank Max for all the assistance and just discussing the data, but also going through those interviews. We have one high school freshman that, if you look at the data, well, in the last month, his attendance, he hasn't been here. So if you look at the data alone, it has one suggestion. But the reality is that it's through the conversations and through the youth council and through the individual development plan that we do with each participant that you understand that, well, this young man started to dress a little different, to take better care of himself, and come to find out that every day after school, he saved enough money to get a gym membership and has been going to the gym. So his arrival time is he arrives late after program is over. So if you just look at the numbers, it's one thing, but understanding the totality. So now it allowed us to sit down and sort of refocus in the evening session with him. Okay, what are the next goals? Or how can you come back to tell your story, to influence and present your growth to others who may need the same inspiration. So I definitely understand the value, and thank you for presenting both.
So we're going to stick with you, Michael. And, Rosalind mentioned COVID. John talked about COVID. We can't talk about kids in education right now without COVID and that impact. So how have the youth you work with, and particularly their experiencing learning both formally and informally through remote instruction, influenced how you see your professional role?
Well, first I want to thank Rosalind for mentioning the word party as opposed to, I think you mentioned it was a party. And I think that's so helpful because it just speaks to relationships and how you present things. One of the things that we do with, and this actually came out of the Youth Council discussion, that families come at different times, different situations. And the Youth Council decided to gather a welcome bag so that each family, as they come in, gets a little welcome bag with a teddy bear, a coloring book, depending upon the child's age, but also some useful things. Say, for example, a phone charger. A lot of times you don't know how you transitioned into a transitional location. And also a handwritten note by one of the kids saying, okay, for more information, reach out to the Youth Council or the after school program. So it just really builds relationships and helps that one-on-one. Because a lot of times, of course, we know that parents may be, hesitant to deal with the, different entities and not really feel as welcome. In terms of how I see my role, one of the things I recognize is that we all do is that youth are so technically advanced. So for them, this pandemic experience has just heightened the use of technology. So I definitely understand and see through my experiences, and more importantly, my role now, the need to help kids, help youth communicate who they are, understand their footprint, and not just the electronic footprint, but their footprint based on who they are, their character, and how they are perceived. So really, just understanding the value of that. We one of our, like I said, our mantras is to help kids. Help youth identify their talent, skills, and abilities. We sort of noticed that a lot of our parents, of course, are dealing with so much that they may not have the time to recognize the skill that a child may have and really cultivate that. So one of the things that we really are purpose to do is to help youth identify their skill and then develop a plan for that. Part of that plan is, a lot of that plan is technical research, but also being able to articulate that, whether it's a quote unquote the elevator pitch, where you have to say who you are and what you're interested in a 30-second span, but also getting them used to articulating that. And whether it's a video, we're really building out our multimedia program. It's funny, kids the same child that will joke in a classroom or out in the schoolyard will get in front of the class to articulate something academic and freeze. So really it's about helping them maximize that which they already have and feel comfortable with it so that they could really grow and develop and present the best version of who they are as they move forward. So in terms of my professional role, I really see, again, that helping each child really grow and develop. We had one child who was, you talk about feel-good stories, a 10-year-old that had the hand-eye coordination that was really amazing. She would, did not have a portfolio book or know how to, understand a portfolio, but she would draw on a napkin or anything. She would take old discarded clothing and make dolls make clothes for her dolls. So her hand-eye coordination in a situation where a parent had maybe less stress that parent may put that child on a track or trajectory to really develop in that field. But because of the level of stress and all the certain things that the family may be going through, they don't really have that luxury. So we're really, again, purpose to help that child use technology, use whatever. And it may mean that they're on that they have a different program when they come down than somebody else. Of course, the STEM, the academic, the homework help is the same. But after that, no, we're putting you on a special track where you're working on your artistic skills while somebody else may be working on their musical skills. So it's really, it's more individual and more intentional as we sort of move forward.
Thank you. And Max, how did interviewing the youth that Michael, just gave some examples of them in the council influence how you see your professional role?
Sure. Yeah. So, I mean, as I said before, interviewing the members of the youth council was really critical for understanding just the value of the program. So we just heard from so many of the members, like why it was important to them. So for example, one of the members that we interviewed, he just continued to emphasize how important it was for like kids to have a voice in terms of influencing the programming, and especially just because as most of the decisions are being made by adults, he just was really excited and engaged with the possibility of engaging with his peers through the programming. So personally for me, those interviews just reinforce the importance of conversations with clients directly, and like in any sort of research that we're doing, and that firsthand experience just needs to be critical for any sort of research or study or anything that you're trying to conduct.
And Rosalind or Joe, if you want to weigh in on sort of what you've seen perhaps change about your professional role during this time, or time either the COVID time or just as Bell has expanded.
Yeah, not to get too sciencey on you, but I'm interested when I work out. I like to use weights, and weights, if properly used, can build muscle. But the only way you can build muscle is if some muscle breaks down first, right? And it sounds horrible, but yeah, they call that muscle hypertrophy, right? So the same happened with the Bell Project. When COVID happened, that was, we had to find new ways of connecting with families. It was difficult, but during those times when we came together after we regrouped ourselves, we became really creative and innovative, and we did some partnerships that really helped us to let our families know, hey, we're still here. One that I will mention is the Reinvestment Fund. One of our ECE specialists had this wonderful idea to deliver to each of the families that we serve a kit with their kids that was age appropriate. The kit was already assembled. They were all different depending on the age of their children. We had them delivered to the shelter through using Lakeshore. So we put together some social emotional items for the children. And we also put some messages in there for the parents so that they, while we were all sequestered and isolated, and they were isolated in sometimes in their rooms, they could play with their children, read to their children, and their children could play using those kits. That's just one way that we use to think outside the box. I know that that term is overused, but we had to do that. We had to say, okay, this is what it is. How are we going to get around this? Another thing we did when I talked about the parties earlier, we had an enrollment party on the sidewalk. One of our other specialists said, hey, I can still do this. We just had the party outside, and we tabled outside. Thankfully, the weather was compliant, and we had some families enroll during that enrollment party. So we just didn't take no for an answer. We were like, we're not going down like this, you know, we're going to make this happen. And I just, you know, part of it makes me feel like we are stronger than we were before the pandemic. And we're not sure of how much muscle has grown. We'll see once we get back, but I think we'll see some growth there.
No, I didn't know if you wanted to add something.
The only thing I would add is most of the shelters did not have any Wi-Fi for the parents. And so combination of, there was a lot of angels out there. And actually the telecoms gave free Wi-Fi through people's phones. But and the city of Philadelphia stepped up and brought a lot of new equipment into it. School District of Philadelphia gave a lot of free laptops. Pennsylvania Head Start State Collaboration Office put in almost like $500,000 statewide. And I know a lot of Philly shelters applied for it and got money for technology and all. So it took a while, but a lot of folks really stepped up to try to make it a better experience. It was still extremely hard for our parents and our kids to be stuck in their units for such a long time.
It really helped with our relationships, right, Joe? I think, you know, our relationships, we were able to pick up the phone and say, hey, this is what's happening. Or people called us and said, hey, how are you? You know, what can we do to help? And I think those relationships that we forged over the past now 4 years really helped during that time of need. Everyone just chipped in, everyone, or at least our partners, our philanthropic partners, as well as community partners said, hey, what can I do to help? And it was just wonderful. It was a beautiful time.
Awesome. So what lessons have you learned through the years of running your program? And what would you say to people looking to build something similar? I think we can start with Joe and everyone else can.
Sure. I've been thinking a lot about this. The need for an intermediary. Government's not going to do this on their own. The shelter system definitely is not going to do it on their own. The early learning community cannot do it on its own. It really has to be that bridge, that intermediary between different systems to bring them together and all. That was number one in thinking about this. The second is that, you know, there are good policies at the state and federal levels, but the local folks' capacity to implement that is challenged, right? It's challenged by leadership, whether or not leaders of certain shelter systems or the shelter system is knowledgeable about what they should be doing for young kids ages 0 to 5. And there's equipment, there's shelter staff. We've experienced turnover at the shelter level about a third every single year, both frontline and executive directors level. Huge turnover, which required us to do consistent training and incentivize folks to step up. So we've actually had to financially and as well as resources bring it to each of the shelters. This is why you're involved in this project, besides supporting the kids and doing what they should be doing and all. Data licensing agreement with the county is extremely important and very difficult. Did not expect that. I know more about cybersecurity requirements than I want to know. And on a negative side, I'm not sure policymakers really get it. And that's, I'm thinking of the state and the county legislators. I just don't think they get the value of children, not only children who experience homelessness, but foster care young kids and just kids with disabilities. I don't think they're really there, they're engaged. They get the information, we talk to them all the time. They get a lot of information, but I just don't see them picking up the ball and running with it and giving us the support that we need from the legislators and all. Roz, anything you want to add to that?
I would add that relationships, and we've touched on this earlier, sometimes those rapport building and relationship building takes time, and give yourself grace. Some things don't happen right away, but then there's just one day you can't identify that moment. When it happens, you see it taking off, right? You see the momentum gaining. So just don't take no for an answer, and keep at it. Don't give up. Don't give up.
And Michael, if you want to jump in about, what advice you would give to people looking to build something similar.
Sure. I would say two things that really stick out to me. One is to really tap into the passion of the staff. We had one staff member that I just found out through conversation that he's rebuilding a car on his own. And, that's something, like I said, it came out during inadvertent conversation. But I said, okay, well, listen, that we have STEM, we have some robots, we have some solar cars. Let's tap into that. So now this person who was who's a youth worker that was assistant is still assistant, but now he has like a number of young mechanics that are working with him to sort of build some solar cars that we have here. So really just tapping into the passion, because the more passionate your staff is about what they do, the kids will feed and into that and just reap the benefits of that. And then the other one is to just to be innovative. A lot of youth programs, whether it's state or city funded, mandate, certain requirements in terms of classes and programs, and I think that they have a great value, but not to be afraid to be innovative in your programming, and sort of as with the youth council, go where the kids, within all respect, take you in terms of their interests and their passion. So don't be afraid to be innovative in terms of programming. Those are the two main things I really think are important.
That's great. So for all of you, what are the next steps for your program that you're excited about?
Well, I'll start and continue. I'm very excited about two things. One is the youth council is, and now our kid council is really focused on, like I said, two things. One is community service, excuse me, and then the other is individual growth. So we're really excited to see just the passion as they understand the dynamics of community service. We said that on different levels, the first community, because it led to a discussion on what is community. So the first community is within the building, within the residential location itself. And then, of course, the greater community. So we're still moving through the community here. The kids held the kids council and youth council, a joint council, held a book fair in the lobby 2 days ago. And it was just a great experience. We had books, and they set up, tables just to see their energy and excitement, because they were doing something for the community. The kids had youth had the opportunity to make an announcement, which is a big thing, because it's it goes over the whole building. But just the way that they were embracing and engaging parents and other youth. So also as a recruiting tool, because now you have kids recruiting kids to different things. So I think that helps as well. The second thing that we're very excited about, and we've seen this as an enormous growth tool, is our family programming that has the youth and their parents working together. We have a ceramics program now, where every Monday we have different families that come in, and the families sit, at their own tables. You have a mother, father, and their child or children at a table, and we have a ceramics instructor that comes in, and they do ceramics and clay making, and it's therapeutic, and it's just so wonderful to see the parents and the kids interacting on a level that is very low stress. There's, like I said, there's staff there, there's a instructor there, so that the mother doesn't have to say, or the father doesn't have to say, no, you're supposed to do it like this. And just allowing the interaction to be authentic and stress-free, I think is one program that is really building out, because now it gives us the opportunity to work with family services and the other components within the a residential location to really build up that family. And it allows them to interact on a level that is something that they may not be used to. So again, that's one thing that we're very excited about growing out in the next couple months.
For Bell, Bell, the Building Early Links for Learning project started with emergency and transitional, and we still do that. We now have companion funding from the William Penn Foundation to provide the same project or same emphasis for permanent supportive housing. So that's Bell PSH. And we received additional funding from the William Penn Foundation to do a project that we're really excited about. It's new, called Everyday Learning Play Spaces. And in these same shelters where we work, the Everyday Learning Play Spaces, and hopefully we'll put their website and we'll give that to you guys to send out. They will develop a custom play space just for that shelter after doing focus groups, talking to parents and the shelter staff, something that both the parents and the children can use. It may be inside or outside. So we're really happy about that happening as a result of Bell. And we are also looking to restart our home visiting project, which started with as a result of Bell in the same shelter system, but we're going to expand it to the city so that anyone experiencing homelessness would be invited to participate. So those are the big next steps. And we have little ones to get to those big projects.
If I can add on the policy front, we have a campaign called Children Cannot Wait, and we're trying to get the Pennsylvania's next governor to say something about homeless young children and all. And then after that's done, we're going after the next, Philadelphia's going to have a mayoral campaign, and we're going to try to get the mayor to say something about young kids experiencing homelessness. On a practical basis, we're doing that because it takes them, once someone gets elected, 6 months to really figure out what their job is. But we want to hit the ground running and talk to the policy people and say, you're committed to this, let's help you achieve the objectives here.
And Max, I don't know if there's anything you want to add to and what you're excited about.
Sure. I mean, for like future projects and HFH policy, I think we're excited to monitor who's coming into the shelter system, just from like the system-wide level as the eviction moratorium expires. I think, yeah, as I was saying before, it's really like important to like keep your finger on the pulse of what's going on like at the system-wide level, and then also pair that with like what's going on in like the micro level of like programming, so that you can have that healthy relationship between the two, and really just make sure that like from the policy side, if you understand who's like coming into the shelter system, how you can best give clients services and whatnot through programs like the Youth Council.
Excellent. Well, thank you all so much for your deep focus on these questions. We have some questions coming into the Q&A now from the audience, and please continue to send them in as you think of them. We are, let's see, going to get started. First question here. Do children ever express how they deal with any stigma attached to being homeless? Does it impact their self-esteem? Are they teased at school? Do they ever express real hope about leaving the shelter and finding their own home? So Michael, do you want to start us off on that one?
Sure. Yeah, absolutely. One of the initial conversations that the Youth Council had was regarding the just that, the stigma in terms of being in a residential location, there happens in this vicinity to be another shelter. And, you know, a lot of times when they either walk from school, there's a perception of three things. Oh, you go to the school, but you live somewhere else, or you live in this shelter or that shelter. So there's a stigma where the kids actually felt or feel that people, when they see, like if they go into a store, people sort of assess which one of those three are you. And they mention that it can be very, very difficult just in terms of that stigma. And that led us into the discussion in terms of individual community, exterior community, and also, most importantly, dealing with yourself and how you value yourself. So I think that stigma is out there. The perception is out there. Kids mentioned that they were sort of frustrated, but again, it led into a very important and foundational discussion in terms of how, like I said, how you value yourself, how you present yourself, how you let other people affect you. So I think that was, you know, one of the initial foundational discussions.
One thing that I learned in doing this job that I never thought of before are things like standard issue backpacks that are given out to shelters, right? After, at some point, sometimes just those backpacks can be identified with living in a certain place. So thinking about, you know, what kind of resources or things that we provide the children that make them feel a part of everybody else and not set them apart. So sometimes things like that could be stigmatized, even for small children. They're all carrying the same backpack to school. So yeah, I think sometimes they experience that.
I think we had, for example, even with the Zoom and the Google Classrooms, we had situations where some parents wanted to, you know, it actually came down to ask us for resources so that they could build a better backdrop. You know, a lot of times, you know, you may see a Google Classroom where you have someone that's going from one room, or you could see the next room in the background. Whereas in, you know, some locations, you know, it's just literally one room, and that's, you know, all you see. So we had parents that came down, like I said, to sort of build a backdrop. And I think, again, that goes into, you know, the stigma of how you view yourself, but also the, you know, the perception. So I definitely agree with that as well.
Excellent. We have first a comment that family engagement is key, which we've heard today is definitely true. And they're wondering, is there a list or a resource of family engagement activities or ideas? I don't know if you want to share any places where you tend to find a lot of ideas.
I would recommend that person to visit the Early Childhood Knowledge and ECLIC. It's ECLIC. It's an acronym. Early Childhood Knowledge and Education website. I'm going to type it in the chat, but there you will get lost. It's a universe of ideas for parent engagement, templates for, and this is sponsored by the Department of Health and Human Services Administration for Children and Families. So it's a federal website, but you'll get ideas, templates for letters to parents, how to organize with families, activities to do, what kind of staff you need. So I will type that in the chat, and that person, whoever goes there, will get lost on that website.
And Michael?
Not, you know, it's interesting, not any one specific that we did. We sort of, again, just try to keep the finger on the pulse, as Max said, just in terms of what's going on, and be innovative in our approach. So, for example, we saw one parent that was talking about cooking. We have a culinary class that the kids do, and just hearing the kids talk about it with the parents, they say, well, okay, now that's something that we may want to do with our parents as well. So that could be a joint, family event. So while I welcome, and we'll actually thank you again for that, Rosa. We'll look at that site. We sort of build from within in terms of what we see our kids. And again, we're fortunate enough to have full wraparound services with family services in the building. So we can sort of coordinate with them in terms of different activities and events as well.
Sorry. We have another question here. What are some strategies to support homeless, lesbian, gay, bisexual, and transgender youth, both in shelter, school, and clinical settings? So I don't know if anyone's programs are specifically focused or have experience with these populations and with any specific strategies.
The Bell Project focuses on young children, although some of these children may have families that have differing or different family dynamics. PEC has projects with our Rise program and other projects that we do. We welcome all youths, whomever just needs the services. But the Bell Project focuses mostly on early childhood.
With us, we don't have a specific, one of the things that we do, we're very, very intentional in terms of individual growth and development, and spend time with each youth individually to sort of just actually develop a path of growth and development. And we've seen situations where that path may say, okay, let's have you let's introduce family services for a discussion that may be a little more therapeutic or a little more a discussion on a different level. Again, having that support system already within. But again, it's through that individual growth plan that those discussions and that path is really directed. So we have not yet seen, but are well prepared in the event that we need to direct somebody or have that discussion with somebody as they grow and develop and identify with who they are.
Excellent. So we were blessed with so many questions that came in during the registration process. So the Q&A is still open if anyone has any other questions that you want to put in. But we wanted to pull some of these questions because they were so great. Someone asked, what are the effects of trauma on learning? And how can providers be mindful of this?
That is a great question, and that's one of the reasons why when we mentioned our three mantles, that one of them was to explore and learn different methods to cope with the emotions, because we know that the intellect is and the academic venue is there, but a lot of times if a child is emotionally upset or emotional through trauma, that it will not allow that academic intelligence to come through. So we do a lot in terms of helping kids manage emotion, and that's, like I said, one of our main mantles that we do. And that takes on a wide range. So, like I said, we have a town hall meeting every day where we circle up, and that's really, again, just to get kids to be in a discussion, to be able to learn how to sit, not in a classroom situation, but in a situation where, because we're in a circle, we interact, and we learn different discipline methods, but also whether it's a word of the day or a word of the week or a child presenting something, just how to deal with things. We asked the kids to pick a topic every day, and for the first couple of weeks, every topic was related to what to do when you get mad, And these are topics that the kids introduce. Well, what to do when you're mad, what to do when you're sad. So that led to a discussion about those topics. So it's very clear that, again, these are topics introduced by the kids that that is prevalent on their mind in terms of how to deal with certain things. So I think that's the first key thing, is really just having those discussions. For some, it may mean, okay, we know you get upset. Everybody gets upset, but how do you handle it when you're upset? So we have one child that we actually timed. Okay, it took you 22 minutes to go through this episode where you were upset. You wound up taking your space. You needed some space. You had space, but you came back. Well, that same person is now down to 4 minutes. So again, the process is at least begins with them recognizing and taking some level of ownership. So now you have a 11-year-old child, at least, charting how he processes the situation. And I think, again, that in a non-clinical way is one of the first steps in having kids or youth recognize the process in terms of dealing with emotions. Because as you point out, not to be long-winded, but if you cannot handle your emotions in check, then the academic piece will ultimately suffer.
I agree with Michael. Sometimes traumatic experiences can impact learning, especially young children as their brains are forming and building. They can have even physiological, biological effects on kids. So trauma is that children experience, if not addressed, and if that trauma is ongoing, it can have a lasting impact on the child. But we believe when kids are in high quality early childhood programs, there are supports there that identify that trauma, help kids, and their families, because it's holistic, right? It's not just the kid, but help kids and their families to address some of the issues that they're facing in their life, so that they can continue to be resilient.
And I would add that the system leaders need to make sure staff at homeless shelters and other systems get the training and the consistent training, to address and account for the high turnover in our programs, particularly in the early learning system. They have very little understanding of the challenges that homeless families and children face. So Bell has had some special trainings just for them to understand that. And so part of between the Bell schedule and the Children's Work Group schedule, we have many trauma trainings that we hold throughout the year. So we're taking upon ourselves, but also the county government does some, and some healthcare systems also offer. And so there's a lot of sharing of when trainings are available, but each individual organization needs to make a commitment to it.
And I think following on that note, we have a question about how we can support students in shelter who have intellectual or developmental disabilities, or maybe who haven't been identified yet, but especially would early intervention would be very helpful for.
I'll jump on that. So if they're K-12 students, we have to advocate with the school to get an IEP in there, and that's a battle. That is a battle. And then we usually, if our case managers can't do it, we do have something called the Education Law Center, which are public attorneys who will help that process and all. But we have to fight the school district on those things. For kids ages 0 to 5, huge problem. I'm not aware of any focus on assisting agencies. Some agencies, they do it on their own to accommodate whatever the family needs and all. And I like to think we're doing a good thing, but I'm not aware of anybody really defining the challenges that shelters are facing when they have a family that has special needs.
Agree.
Yes.
Michael, I didn't know if you wanted to add more or you were
Yeah,
agreeing. Mhm.
no. I would definitely agree. And add again, that's one of the things why we're a big proponent on that individual plan. That we have some youth, one or two. The middle school kids do a check-in as soon as they come in, but there's one prior to that where we literally check in with this person who has IEP, and as soon as he gets off his bus, to sort of gauge where he's at, how is his day in school, because we know that that is going to affect his his emotional um, viewpoint as he enters the after-school program. So I think even building that time aside for that individual check-in, I think has proven to us to be very important.
I'll also add that the experience in Philadelphia was that we petitioned the county to put in our contracts, emergency transitional housing, that within 2-3 weeks, we had to talk to the parents of children ages 0 to 5, about what early intervention is and whether the parent wanted to understand if their child was on their appropriate trajectory for child development. That might lead them toward early intervention. That was terrific. All the agencies, we did training on how to do that. And so there's a ton of referrals to the early intervention system. And then we changed state law after a campaign, and where the word homeless was added to those who would be categorically eligible for tracking and being provided services for early intervention. When that happened, the city took out of our contracts that we were responsible for that and put it on the county. The county was overwhelmed and didn't know where to find homeless kids, so that whole system fell apart. And so kids ages 0 to 5 just were not involved there. There is a special program now called the FIT program here in Philadelphia, and they're doing their best to try to get into the shelters. COVID certainly has derailed that whole thing. And hopefully that's some work that we'll be able to pay attention to in the future.
And I think we have time for about one more question here. How we've talked a lot about family engagement, but I think this is specifically really about, I think, more with the formal education piece. How can we involve parents more in their children's education, while of course being mindful of the stresses that are going on in the adults' lives? And obviously during COVID, parents were, with whether they wanted to or not, were pulled into their children's formal education.
Well, I'm a Head Start. The federal Head Start program just runs in my blood. And Head Start programs are required to have a parent committee or a policy council, which is a formal process for parents being involved. I say formalize it, have something that is regular for parents if you have to start small. And I think that if we come from a strength-based approach, saying, not assuming that parents don't want to be involved, they do want to be involved. And it just may require us to be innovative about ways to get them involved. Does being involved mean sitting around a table every month? Maybe not. Maybe there's another way, or varying ways that families can be involved. But I would just say be creative. Ask parents how they want to be involved. Ask them, talk to them, and that's a great start. And then formalize it.
Yeah, I would definitely agree. I think it's the combination of having that formal, that formal parental committee. We have that. And I think we get a great mileage out of that because it provides insight and information and direction as well. But also, again, we try to be, as you point out, innovative and sort of intentional. So say, for example, if there's one of the families that we know may need child that may need some special, we'll put them in a ceramics class so that they'll do ceramics first. And after that, oh, well, did you finish your homework? Okay, let's do your homework so that they're right there. On occasion, not all the time. But I think that helps because the reality is that a lot of the parents may be intimidated by the work themselves. You know, one child asked me to help them with the work, and I took a look at it and had to do a double take. So, so a lot of times I think that you know, reducing the parents' fear. You know, the parents will say, "Oh, help them with the homework. Make sure that they do the homework," because I don't want to take on that responsibility. Maybe not because I don't, but maybe because I can't. So I think just reducing that anxiety, and again, that comes from conversations with the parents on a formal basis. But also, as you point out, having that, you know, your finger on the pulse of what's going on. So I think it's a combination of.
Good points, Michael. I'd like to add that the Bell Project was based off of interviews and focus groups with parents. We asked them, what do you know about this subject? What do you want about it? What are the barriers that you're facing? What do you know about child development? And so taking that information, we developed the Bell Project and all. So.
Excellent. So we are a few minutes shy of 1:30, and we know at least people on the East Coast probably want to get outside. So we hope the weather is wonderful everywhere too. But we want to thank the panelists and the organizers for making this event happen. And although we can't see you, we want to thank all of you for making space in your busy schedules to join us today and to ask thoughtful questions and raise really important points. In the coming days and weeks, as Caroline already mentioned, and I know has been in the chat, but we'll say again, we want to ask that you watch your inboxes for a few things. First, we're going to be sending out a recording. So all registrants will receive it. So if you joined late or left early, and want to watch the entirety of the remarks, or you want to share with a colleague who missed it, you can do so. And if you missed that email for some reason, the recording will eventually be up on the ICPH YouTube page and on the ICPH website. Also, please watch for a brief evaluation survey, which we would greatly appreciate if you could complete, so we know what we did well today and how we can improve for future events. And speaking of future events, we hope that you'll join us for additional conversations like this one that will build on the topics presented in the Beyond Housing magazine. And I know that link was put in the chat, and I'm sure it'll go out again with the survey. So stay tuned for details on future events, and thank you. And we hope you enjoy the rest of your afternoon.